Hello, my name is Malin Keto-Tokoi. I'm the regulatory manager for Benecol, and today I'm going to talk to you about the basics of health claims, the ABC of health claims in EU. The nutrition and health claim legislation was introduced in Europe in 2006. Before that, there were no uniform rules and regulations, and each and every member state had a little bit of different kind of rules regulating the use of health claims. This led to the fact that the goods and foods, the movement was not free, and it led to unfair competition. However, the main reason for this regulation is the consumer. This legislation protects the consumer and helps the consumer to make healthy and informed choices. The nutrition and health claim legislation, it regulates all claims made on foods and the communication that is directed towards the consumer. Health claims are only allowed if it's expected that the average consumer can understand the benefits that the claim is stating. The regulation does, however, not cover the communication that is directed towards the healthcare professionals. What are then nutrition and health claims? They are pictures, text, symbols that states that or suggests that a food has some kind of particular characteristics, and they are not mandatory. You don't need to use nutrition or health claims if you don't want to. The regulation and also the health claims, they can be in any forms. They can be on the internet, they can be on television, they can be labels on food, they can be in the newspaper. The legislation covers all of these. And also, image marketing is part of the health claim legislation. As the legislation states, it says nutrition and health claim legislation. There are two parts. First, we have the nutrition claims, and a nutrition claim is something that really states something positive about the nutritional properties of the given food. For example, high fiber, sugar-free, or source of calcium. These are examples of nutrition claims. The conditions for the use of a nutrition claim is set in the regulation. The other part, the health claims, that is something that shows or states that a food and the health has a relationship, that there's a benefit from taking a food. Health claims are divided into different categories. We have the so-called Article 13 function claims. These are claims that are, for example, related to growth or weight control. Or if you have new health claims that are in relation to these fields. And then we have the so-called Article 14 claims that are the strongest health claims. And these are the disease risk reduction health claims, and also health claims that are related to children and development in children. The European Food Safety Authorities has already finished assessing the major part of the Article 13, the functional health claims. If you want to have a new claim, you can still put in an application, and that is, of course, something that is always done for Article 14, these disease risk reduction, these strong claims. For those, you always need an application. And when you put in an application, EFSA will assess. After the EFSA assessment is done, the European Commission make decisions based on the EFSA opinions, and the claims will end up on a list of approved health claims or a list of not authorized health claims. Examples of approved health claims are, for example, if you think about these functional health claims, for example, beta-glucan, you can say that it maintains, it's for maintenance of normal cholesterol levels, or for protein that it maintenance of muscle mass. When you go to the disease risk reduction health claims, one good example is, for example, plant stanol ester. The claim states that plant stanol ester have been shown to lower or reduce blood cholesterol, and high cholesterol is a risk factor in the development of coronary heart disease. Health claims can be made only on foods that have good nutritional properties. For example, you need to take into account the amount of fat, the amount of sugar or salt in the food. And on the European level, the nutrient profiles have unfortunately not been set yet. EFSA is still working on those, and one day the Commission will introduce also these nutrient profiles. Only a couple of these strong health claims, this disease risk reduction, Article 14 health claims, are approved. Some of them relates to the heart health and the reduction of blood cholesterol, for example, plant stanol ester and oat beta-glucan. And others are related to dental health. If you want to find out more information, there's a really good database on the European Commission website. The schedule now for how these health claims are implemented. The legislation came into force in 2007, and the Article 13 claims, there was a lot of them that were sent into the Commission by January 2008. Actually, there were over 44,000 claims that were sent into the Commission. EFSA assessed the claims, and in 2012, finally a list of approved health claims were published. And also at the same time, a list of the not authorized or rejected health claims was issued. And from the beginning of 2013, only health claims that are authorized can be used. If you want to make a new application, if you had new information, scientific information, you can apply for a new general health claim, or you can send in an Article 14 health claim application. And EFSA will assess those health claim applications, and based on the EFSA evaluation, your health claim will end up on the authorized health claim list or the list of rejected health claims. Benecol is even today, involved in the field of nutrition and health claims, and maybe one day we also will have some new health claims for Benecol products. Thank you.